Thank you very much. A few follow-up questions. I wanted to ask two on the challenge of broadening our mental health workforce. Senator Kaine accurately talked about diverting individuals out of the criminal justice system. Often your first interaction with the criminal justice system happens at school. Many kids with mental illness will misbehave at school, will run into a police officer, and be sucked into the criminal justice system, never to emerge. We talk a lot about mental health first aid training. To the extent that schools have police officers on site, shouldn't every single school-based resource officer have some basic training in identifying mental illness so that they can divert kids away from jails and into treatment if they present with symptoms?
Yes, and without endorsing a particular program,
Right.
yes, I believe that is the best way to approach that issue. Absolutely.
And then tell me about Samson's work to develop more peer capacity. Peers occupy a very specific and useful role in treatment. Lots of emerging data telling us that for many people in recovery, that peer connection is what matters most. Give me an initiative that SAMHSA is working on now to try to broaden and improve the quality of peers in our system today.
So SAMHSA has had a pretty substantial role in the development of the peer workforce. However, it's my view that SAMHSA, no government agency should be in the business of trying to figure out how to accredit a particular type of workforce. And so what we are doing is we have an office for consumers and families that is working with some national organizations on developing criteria for accreditation of peers. The states are all different. They do it differently, but we are working with states and with the stakeholders to move that process along. I believe that peers need to be integrated into the healthcare team because it's so important to not just give medical care, but also the recovery services. And so that's what we're working toward.
One last question to follow up on a conversation you were having with Senator Cassidy. You mentioned that you were not satisfied with the data that you were receiving from states. I think that's in relation to the block grant. Can you just tell us why you're not satisfied with the data that you're getting? Is it the amount of data or the quality of data? What's the problem that you're seeing?
Because the data does not tell us anything about diagnoses, and it doesn't tell us anything about really basic standard of care issues like did a person get medication-assisted treatment? How do I know if a program's working if I don't even know they got the standard of care? We're changing that.
What do you get? So what are you getting right now?
We get number of people served. We get things that approximate certain types of diagnoses. Did you feel sad? Do you use certain substances? But that is not enough to tell us what these programs are doing, for who, and what does and doesn't work.
Well, thank you for your focus on data, and I agree with Senator Cassidy that to the extent we can avoid duplication in requirements to states on this, it's something we should work together on.